All right, Rad Nation. Today we're going to be talking about image noise, and this is something that often is just referred to as image quality in CT reconstruction, and the technical parameters that are involved in setting the image quality on your CT scanner. Coming up here at How Radiology Works. First off, what the heck is noise? Why do I even care about it? If you're a technologist, if you're a radiologist, the reason you care about noise is on your scanner, you need to come to a good trade-off in the noise that you can see through in your image. And what is noise? If you look at this image here, there's actually some objects inside of that image. But can you tell me with high confidence how many objects there are, what size they are, and where they are in this image? I certainly couldn't. But as you reduce the noise, so the noise is actually what we call random fluctuations in the image or changes in the value from pixel to pixel that are not actually caused by the underlying anatomy. So as you go from this direction here of low noise to this direction of high noise, you have less confidence in your diagnosis and the ability to characterize the actual underlying anatomy. So that's the concept of what noise is. We're going to talk more about how we can think of this in terms of going from pixel to pixel in these images and thinking of the noise as coming from a statistical distribution. The thing that the noise variance actually depends on in our images, as just a sneak preview, the most important thing is actually the in-plane spatial resolution. So if you've seen our video on image resolution, you know that higher resolution means you can tell apart two small objects which are close together better. If you have lower resolution, the image will look more blurred. You won't be able to see these small objects and tell them apart. So this is just an example of a lower resolution and a higher resolution image. Resolution does come at a cost in terms of the noise. So from the theoretical standpoint, it goes to the third power with the spatial resolution in plane that we're calling F here for the frequency. If you don't know what frequency is, definitely see our video about image resolution. The next thing is the Z direction. So if you look at stickers, you're actually going to have less noise because you're averaging more along the direction of the slice thickness. Then the final thing is the dose. So the actual number of X-ray photons which are used will determine the noise in the image. It's actually inversely proportional to both the thickness and the dose, and we're going to go over that in just a minute. So first off, from your high school statistics, if you remember anything about statistics, you probably remember we have a bell curve. That curve we also call a normal curve or a Gaussian curve, and it's parameterized by a couple parameters. It looks a bell shape, right? So we call it a bell curve, and the mean value is right here in the middle. On the x-axis is our independent parameter. So in this case, it will be actually the Hounsfield unit value that is due to noise in our CT image. So if you think about your CT image as being composed of a true anatomy plus a noise term, then we're talking about that noise term now. Imagine our true anatomy is just a water phantom. So the values in that true anatomy should be 0, and then we're adding a noise term to that. So if you think about going from pixel to pixel in the image, and then each time we'll take a sample from this distribution, and the likelihood is on this axis, so we call that the probability density function, or the likelihood is on this axis that is 0 on this axis is actually the thing that's most likely, and then having a value with a higher deviation or a bigger difference in Hounsfield unit is actually less likely. So the mean value is 0 for a typical Gaussian, and then the standard deviation here is the other parameter, and that determines actually the width of this function here. Then if you compare some Gaussians with different standard deviations, you can get a sense to see what they would look like. So again, a standard deviation of 1 would look like this, and then this is 1 with a standard deviation of 2, and then this is 1 with a standard deviation of 4. You can get the sense that if it has a wider standard deviation, then again, on this axis here, in our case, we're talking about the CT number. So you're actually likely to get values that are more different from the value of 0, which is your baseline value on your CT image, which is the case of water. Those different values are actually what makes it more difficult to see through the image, wherein if you have a smaller standard deviation, then you're more likely to get more values that are closer to the value of 0. And what does that look like in an image? Like we talked about, a standard deviation that's higher, you're more likely to get more values that are different from 0 that are going to be added on top of your baseline anatomy. And if you have a standard deviation that's lower, then you're more likely to get values that are closer to 0 to be adding on top of your baseline anatomy. We've got another video on contrast to noise ratio, and we talk about in there the way that we want to measure the noise in any distribution is actually looking at the variance. And so what we'll do in our image is we can define something called Q mean here. So for instance, if we have a water phantom, the mean value should just be 0. Then we'll go to every pixel, and within that pixel, we will actually say, what's the difference between this value and what the mean value is? And then we'll take the square of that so that the negatives won't cancel out. We'll do that for each pixel, and then we'll divide by how many pixels we had minus 1 to normalize by how many pixels we had. Again, this is called the variance. And you see we're using this symbol sigma here, but here we're using it sigma squared. So this is actually related to that bell curve that I showed you. This is what we call the variance, and the standard deviation that was that width parameter that I was showing you. That is the square root of this. So we can calculate this parameter, then we can take the square root if we want to get the standard deviation. So far, I've just been talking about Gaussians because that's the simplest one. You're most familiar with that bell curve. But just for a quick second, bear with me, there's something also called the Poisson distribution, and that is a more accurate model for a counting process that happens in time. And in this case, the counting that we're going to do is actually the number of X-ray photons that are coming out of our X-ray tube. And the Poisson distribution, we wrote at the bottom here, but you don't have to worry about the formula per se. But the Poisson distribution just has one parameter, and the Poisson distribution can be well approximated by the Gaussian when our number of counts is relatively large. So if our number of counts is very small, then the Poisson actually, you can see it's left truncated. It doesn't look like a bell curve anymore. It's truncated off to the left. So in that case, Gaussian is not a perfect approximation, but once your number is more than 10 or 20, Gaussian is really a good approximation. You can see when our number is 50 here, there's really no difference here between the Gaussian and the Poisson distribution. So if we're talking about the number of photons that we're measuring on the detector, as long as that number is relatively large, like it is in CT, then we can use Gaussian as an approximation. So that's typically what we do in our CT imaging. But the noise in our image actually first comes from noise in the projections. So how do we get that noise in the projections? We actually start with an X-ray tube, right? So if we have an X-ray tube, and then the X-rays, imagine they're passing through the patient, but imagine here my patient is just a cylinder of water. So they're passing through the patient, and imagine also for simplicity that they all are of just one energy. So if I have one given number of X-rays, we call that N naught, or the number of X-rays that are coming in, the distribution actually is going to follow what we call a Poisson distribution. So the input is going to follow a Poisson distribution like we show here. And then the way that they interact inside of the matter, it's what we call binomial distribution. So that means there's two options for a binomial distribution. They can either stop inside of the matter or they can keep going. Those are the only two options. So if they interact in the matter via photoelectric or Compton, that's one option. The other option is they keep going. That's a binomial distribution. And then it's been shown that if we have a Poisson distribution followed by a binomial distribution, that is just equivalent to a Poisson distribution with a little bit different parameters. We have a Poisson distribution coming out. And like we just talked about, as long as our number of photons is not very low, we can well approximate that by a Gaussian. In some types of nuclear medicine where we have very low count rates, you might want to use Poisson modeling, but in CT, a Gaussian is typically a good approximation. Let's imagine we have a perfect detector. The number of counts we have hitting the detector is actually just Beer's law. We've talked about that on the channel before as well, but it goes like n naught, and then there's an exponential attenuation as you're passing through the matter. The mean number that we're going to have is just n naught, and then it's going to be exponentially attenuated like e to the minus mu, which is our linear attenuation coefficient, times the thickness here, which is x. That's the thickness across. So what we measure then is the projection data, and we want to linearize that projection data. So here we have an exponential term. It's not fun to reconstruct things with an exponential term. So we take a natural log in order to get our projection measurement. So our mean projection measurement is just a natural log of the ratio of these two things, the measurement of the incoming photons and the photons that are coming out. So in CT, we'll typically have a detector at the side. So we have a good estimate of the number of photons going in and then the number of photons that we measure on the detector. And like we talked about, there's actually noise in those measurements. And it just goes like 1 divided by the number of measurements that we have on the detector. So as you have more measurements on the detector, you will have lower noise. And how do you get more measurements on the detector? You actually need to send more photons through the system, right? And because we need to send more photons through the system, those photons, when they're in the matter, they can interact, right? So the dose that's deposited is directly proportional to the number of photons that we measure on the detector. And because the noise is directly proportional to the number of photons that we measure on the detector, we can say that the noise in our images is actually proportional to 1 divided by the dose in the images. So this is why there's actually a trade-off, because from a noise perspective in the image, we'd like less noise, so we want to have more photons contributing to our image. And from a dose perspective, in terms of trying to minimize the potential long-term consequences of using radiation to do the imaging, you would like to reduce the number of photons or reduce the dose. That's where the trade-off is, and you need to always be making sure you can make a diagnostic image, but you would like to use a low enough dose such that you can make that diagnostic image with confidence. Here on MA, we talk about essentially the Goldilocks principle, where you want enough radiation in order to get the image, but not too much radiation. If the noise is really low, you know you've used too much radiation. And if the noise is so high that you can't see what you're looking for in the image, then you haven't accomplished the purpose of taking that diagnostic exam. The noise variance here goes like the frequency to the 3rd power. Again, this is assuming filtered back projection reconstruction and also assuming relatively standard convolution kernels. It's inversely proportional to the slice thickness and to the dose, like we just talked about. So you should be able to remember that. In-plane spatial resolution to the 3rd power, and then divided by the slice thickness and the dose. It's that simple. You know, a lot of times when things are presented, people present many of the terms all in a row, but if it all comes down to it, it's just this simple. If we're a physicist, we want to think about the simplest model that we could do. And so we take a human, so the abdomen or the head, and we think about there's actually going to be noise in these images. That noise does have some directionality. We talked about why we would want to do tube current modulation in a recent video, so check that one out if you haven't seen that one already. That can reduce the directionality of the noise in your image. But at a high level, you can think about modeling this abdomen with a water phantom. And we want to measure the noise in this water phantom and see, in general, if a certain set of parameters will give us higher noise here, then it would likely give us higher noise here, especially if they're relatively similar size. And we also make an approximation, which is nice because from statistics, what we actually talked about earlier is thinking about we're at 1 pixel in the image and then thinking about it's a distribution. Like if we roll the dice, we have another video where we talked about rolling the dice as an analogy for our noise in CT. But if you think about what you'd actually like to do to get measurements from that distribution is to take a measurement in that pixel at one time, then scan again, take a measurement again, then scan again, take a measurement again, then scan again, take a measurement again, scan again. And each time we'd be looking at the noise in that 1 pixel. What happens in reality is we actually don't want to sit at the scanner and scan it many times in order to get those values corresponding to a nice distribution. So we make the assumption that it's a similar value if we actually look, because this is a water phantom, the values of the background are all the same. If the noise is independent, we can approximate making the measurements in the local pixels instead of making the measurements in the same pixel over time within our phantom. Like we talked about, the equation's very simple. From a theoretical standpoint, it goes like the frequency to the 3rd power, and in some measurements, it can go to the 4th or 5th power. See our other video on the technical parameters in CT and how they influence the dose. You can see here that the dose in our image goes like the kVp to the 2.5 to 3.1 power. Again, that's dependent on how large the patient is. And then it also goes like the MA times the time. So in general, all these things make more photons, and that's going to deposit more dose. And then at the bottom here, we have the pitch. If you go to a lower pitch, you actually end up having more redundant measurements, and that will increase the dose. So that's why this is on the bottom. So if we plug that into the equation that we just had, then we can see our sigma squared, or our noise variance, goes like this. And like we talked about on the system, we'll typically make measurements and we'll typically report those in the standard deviation because those have the same units of Hounsfield unit. So we'll want to look then at the square root here. Inside, we just have the in-plane spatial resolution to the 3rd power, roughly, times the pitch. Those are on the top. And then in the denominator, you have the kVp, you have the slice thickness, the MA, and the time. So if we just look at this and we said we wanted to minimize the noise in the image, we might come out with some solutions which wouldn't be the optimal from an imaging perspective. And the reason is we don't want to minimize just the noise in the image. Typically, in order to perform a given task in the image, what we're actually more concerned with is the contrast to noise ratio. So see our other videos on the channel. If you don't know why the contrast changes as a function of kVp, we've got a couple good videos on that on the channel. But at a high level, when you go to lower kVp, especially if your task is iodine or bone dependent, when you go to lower kVp, your contrast is increasing in the image as well. We'll have another video talking about kVp selection, why it's important in order to optimize your imaging from a CT perspective. The kVp is something you want to usually determine first before setting your parameters. We've talked about that before because the kVp is the one knob we have in CT to change the contrast. Unlike MR, where there's many knobs to change the contrast, we really have just that one knob. So you want to set that one first. Then given the constraints of the system and of the size of the patient and so on, then you go to looking at the other parameters in order to set the best acquisition for the given task. Keeping in mind that these things are going as the dose. So we talked about in our other video, a lot of times you'll want to actually conserve the dose in your protocol such that you'll get the same noise. Then you'll see the pitches on the top. So if you go to higher pitches, you have less redundancy. You go to lower pitches, you have more redundancy. So you want to take that into account. If you lower the pitch by a factor of 2, going from a pitch of 1 to a pitch of 1/2, then you can lower the MA or lower the time in order to compensate. In the denominator, we've got our kVp to a power of 2.5 to 3.1. We've got our slice thickness. So don't forget, as you're making thicker slices, you're doing more averaging there, but that's going to reduce the noise in your images. Also, if you turn the MA up or if you have a longer rotation time, those are also going to reduce the noise in your images. You can think about pulling any one of these terms out. If someone asks you what's the dependence of noise on the thickness, or what's the dependence of noise on the MA, or what's the dependence of noise on the rotation time on its own, those all would be just like 1 over the square root of that parameter. Congratulations. Now you finally know how noise in your CT image depends on these technical parameters. Definitely check out our video on the way that dose depends on these technical parameters, because that was key really here in order to insert the values depending on dose. So see that video next.